My parents are both ex-smokers. I watched the impacts on their health when I was a young one and felt that's not something I want to do. Although there were pressures in high school to smoke, I always thought about my parents, how they've been affected by smoking, and I thought I'm not going to give in to the peer pressure and I'm going to continue choosing not to smoke and making those good decisions. My name is Lewis Brown. My connections are Yorta Yorta Jaja Rodong on my mother's side, and on my father's side I'm a Gundi Chamara man. The reason why I didn't take up smoking is a number of reasons. Smokes are very expensive. I have friends, I have family that smoke, and I feel like it's an absurd amount of money that they spend on cigarettes. I look to be a role model to my son. I look to be a role model to my nephews and nieces, my little cousins, and I feel that if I was smoking, they might see that as something that they can do as well, or that's something that's cool, or I don't want to be that role model that is displaying what I feel is poor financial decisions, what I feel is a poor health decision. I also look to our organisations like the Victorian Aboriginal Health Service about their non-smoking campaigns, and I've learnt so much about it, and I feel like that's a big aspect as to why I don't smoke now. Watching both my parents make the decision to give up, they instantly started feeling better, and although it was a challenge for them, I think that they've done really well to be non-smokers. I can take my son to the park and not get puffed out. He's quite energetic. If I was smoking, that might not be a reality for me. I might be puffed out on the park bench. I'm going to be cluing him up about the health disadvantage that comes with us as mob, that we're not quite genetically caught up to in comparison to the mainstream, but we're going to be encouraging honest conversations, and he can have yarns to his grandparents about how they gave up and the differences between smoking and non-smoking, and I really feel that will help him. In high school, I watched my close friendship circle all pick up smoking slowly, one by one, and I felt that's the time where I was most pressured. But I listened to my elders, I listened to the people before me, I listened to the Aboriginal Health Service, and I thought, that's not something that's worth it for me. My message is don't give in to that pressure, because later down the track you're going to be looking back and saying, I am really glad that I didn't make that decision to smoke. I'm able to keep up with my son. I'm able to make these good, healthy decisions. I'm also able to afford nice things like nice shoes, and we recently made a nice car purchase and things like that. That's something I wouldn't be able to do if I was smoking. I feel confident that I can live out a nice long life and see my grandchildren and potentially great-grandchildren as well. I'm very proud to have seen my parents give up smoking. I'm also very proud of my late pop, who was 60 years of smoking, and I was so proud to see that he made that decision to give up, and we were able to enjoy a few more years with him. I'm so grateful to the health service who really pushed that message. It's because of that we got to enjoy those last few years with him.